All right, today we are jumping right into the incredible microscopic world of your body's internal chemistry. We're talking about the constant, delicate balancing act that's happening inside you right now with fluids and electrolytes. Let's get into it. So just think for a second. What is it that keeps your body's finely tuned engine running perfectly? From your brain firing off signals to your muscles contracting, how does it all stay in sync? Well, the answer is this amazing, complex system of balance.
And that brings us to what I like to call the body's Goldilocks principle. You know, just like the story, your body doesn't want things too hot or too cold, too much or too little. For everything to work, it all has to be just right.
Now, there's a scientific name for this, and it's homeostasis. It's this nonstop background process of keeping everything on the inside stable and happy. And who are the main characters in this whole story? The ones doing all the heavy lifting? That would be your body's fluids and electrolytes.
But what happens when that perfect balance gets all thrown off? Well, your body starts leaving clues. And to figure out what's going on, we have to put on our detective hats and do a little investigating.
And our, let's call it a crime scene, is the body itself. We start looking for those first clues in the most revealing places, your blood and your urine. For doctors and nurses, lab results are like a magnifying glass, giving us this incredible, detailed look at what's really happening inside.
Okay, so this table here shows us our baseline, what a healthy system looks like. So BUN and creatinine, they're basically waste products that your kidneys are supposed to be filtering out. Their levels tell us how good of a job the kidneys are doing. And urine-specific gravity, well, that's just a fancy way of saying how concentrated or watery your urine is. Think of these numbers as the all-systems normal lights on your car's dashboard.
But here's where the real detective work comes in. It's not just about one number, it's about the relationship between them. And here's the big takeaway. If that BUN level shoots up, but the creatinine level stays pretty much the same, that is a massive clue pointing straight to dehydration. It means the body is so desperate for water that it's holding on to everything it can, which makes that BUN waste look way more concentrated in the blood.
So this brings us to the two big states of fluid imbalance, right? You can either have too little, which we call a fluid deficit, or you can have way too much, a fluid excess. Let's look at how these two opposites show up in the body.
First up, let's talk blood pressure. It's pretty intuitive. Imagine your blood vessels are like garden hoses. If there's less water or fluid flowing through, the pressure drops. But if you try to force too much water through, the pressure skyrockets. Simple as that.
You can actually feel this difference in the pulse. With a fluid deficit, the heart just doesn't have a lot of volume to pump around, so the pulse feels kind of weak or thready. But on the flip side, with too much fluid, the heart is working overtime, and that pulse feels really strong and powerful. We call that bounding.
And here's a sign that any of us can check for ourselves. When you're dehydrated, your kidneys go into conservation mode, holding on to every last drop of water. The result, your urine gets dark and very concentrated. But if you have too much fluid, your body's trying to get rid of it as fast as possible. So your urine is going to be light and very dilute. And finally, probably the most straightforward clue of them all is body weight. I mean, since we're mostly made of water, a sudden, unexplained drop in weight often points to a fluid deficit. And you guessed it, a sudden gain usually means you're holding on to excess fluid.
Now, just talking about the amount of fluid is only half the story. That's kind of like talking about a swimming pool without mentioning what's actually in the water. Because dissolved in all our body's fluid are these tiny electrically charged particles, the electrolytes. And believe me, these are the real power players, controlling everything from your heartbeat to your nerve signals.
So, to remember the signs of dangerously high potassium, also known as hyperkalemia, clinicians use a mnemonic that's, well, it's pretty dramatic, but it is super effective. They remember the word murder. And yeah, it sounds intense because the condition itself is intense.
So let's quickly break that down. Potassium is absolutely critical for your muscles and nerves. Too much of it, and you get muscle cramps. It messes with the kidneys, causing urine abnormalities. It can weaken your breathing muscles, leading to respiratory distress. And here's the big one. It seriously interferes with the heart's ability to pump, causing decreased cardiac contractility. You can see this as dangerous EKG changes on a heart monitor. And finally, it can mess with nerve signals, which affects your reflexes.
Okay, on the flip side, let's talk about what happens when calcium gets too low. That's hypocalcemia. For this one, the mnemonic is way friendlier, I promise. It's just CATS, a really simple way to remember a pretty complex problem.
So what does CATS stand for? Well, low calcium makes the whole nervous system kind of twitchy and overexcited, which can lead to convulsions. It also messes with the heart's natural rhythm, causing arrhythmias. It can cause tetany, which are these really painful involuntary muscle spasms. And most dangerously, it can cause spasms in the airway, creating a high-pitched breathing sound called stridor, and that is a true medical emergency.
All right, so we've gotten pretty good at identifying the problems. But the big question is, how do we fix them? This is where the clinical toolkit comes in. All the specific interventions we can use to get the body back to that happy, just right state of homeostasis.
And the single most powerful tool in that whole kit is intravenous fluid, an IV. It is by far the fastest and most precise way to adjust fluid and electrolyte levels because it delivers exactly what the body needs, right into the bloodstream.
So let me give you an example. Let's say a patient has swelling in their brain cells, which is a really dangerous condition. We can use a special type of IV fluid called a hypertonic solution. Now, this stuff is extra concentrated with particles. So once it's in the bloodstream, it acts like a powerful magnet, literally pulling all that excess water out of the swollen cells, causing them to shrink back down to their normal, healthy size. It's amazing.
This little chart here is a great summary of the 3 main types of IV fluids. So, isotonic solutions are balanced. They just hang out in the blood vessels and add volume. Hypotonic solutions are more dilute, so they move water into thirsty cells to rehydrate them. And as we just saw, hypertonic solutions are super concentrated, so they pull excess water out of swollen cells. Each one is a very specific tool for a very specific job.
When you really step back and think about it, your body is performing this constant, incredible, delicate dance every single second of every single day, just to keep you alive and well. So the question I'll leave you with is this: what choices are you making to help your body succeed in its non-stop quest for balance?